You pay $400 a month for health insurance. You think you're protected. Then your kid breaks an arm and suddenly you owe $12,000. The insurance you trusted becomes a contract designed to fail you when you need it most. You're not sick because you're poor. You're poor because you got sick. And every premium you pay is just rent on a safety net with holes big enough to fall through. The system isn't broken. It's working exactly as intended. And if you've ever chosen between filling a prescription and paying rent, you already know this truth. They sold you peace of mind and delivered financial ruin instead. Here's what they don't tell you about health insurance. It's not insurance. It's a subscription service to financial torture. You pay every month for the privilege of going bankrupt slower. That premium isn't buying you healthcare. It's buying you the right to argue with someone in a call center about why your life-saving medication isn't covered. You think you have good insurance because your employer pays most of it. But when you're laying in that hospital bed and staring at a bill that costs more than your car, you realize your employer was just the middleman in a scam. The insurance company already calculated how much they'll pay before you even get hurt. And it's always less than what you'll need. They know the hospital charges $10,000 for an x-ray. They know you can't negotiate from an ambulance. They know you'll pay anything to live. That's not a business model. That's extortion with a customer service department. The worst part isn't the bills. It's the shame. You're supposed to be grateful for the insurance you have. Everyone tells you how lucky you are to have coverage. Lucky, like winning a lottery where the prize is only going bankrupt from a heart attack instead of a broken leg. You start avoiding doctors because you know every visit is a financial gamble. That chest pain could be nothing. Or it could be something that costs $50,000 to find out. So you wait. You Google your symptoms like a detective trying to solve your own death. You buy over-the-counter medicine for problems that need prescription solutions. You become your own doctor because real doctors cost more than your mortgage. And when you finally do get sick enough to need help, you're already so far gone that the treatment costs even more. They've created a system where being responsible with your health means risking your financial life. And being responsible with your money means risking your actual life. Every medical bill comes with a payment plan. Sounds reasonable until you realize it's a 20-year mortgage for your appendix. $60 a month for the next 2 decades. Because you had the audacity to not die from an infection. You're making payments on organs you were born with. The hospital billing department becomes your second mortgage company. They send you Christmas cards and birthday reminders about your outstanding balance. You're not a patient anymore. You're a debtor with a pulse. And here's the sick joke. You can't discharge medical debt in bankruptcy as easily as credit card debt. The money you spent on shoes can disappear in court. The money you spent to stay alive follows you to your grave. They've made survival a luxury item with financing terms that would make a loan shark blush. Your kidney stone payment plan has a better interest rate than your student loans. That's not healthcare. That's legalized extortion with an amnesty program. The insurance company has a team of people whose only job is to say no to you. They're called claims adjusters, but they should be called professional dream crushers. They have medical degrees in denying coverage and PhDs in creative interpretation of policy language. Your doctor says you need surgery. Your insurance says you need to try yoga first. Your pharmacist says this medication will save your life. Your insurance says this generic pill from 1987 should work just fine. They turn your medical emergency into a research project. Prior authorization becomes a death panel run by people who've never seen your face. You're dying while they're deciding if your death is cost-effective. And the beautiful part is you're paying them to kill you slowly. Every premium is a donation to your own execution fund. They're not evil. They're just doing business. And in their business model, your survival is bad for quarterly profits. Medical debt is the only debt that comes with trauma. You're not just broke, you're broken. Every bill is a reminder of your worst day. That heart attack wasn't just a medical emergency. It was the day your credit score died too. You survived cancer, but your bank account didn't. You beat the disease, but the treatment beat your retirement fund. The stress of paying for your health problems creates more health problems that cost more money. It's a perfect cycle of destruction. Your anxiety about medical bills gives you anxiety that needs medical treatment, that gives you more medical bills. You can't afford therapy for the depression caused by the debt from treating your depression. The system feeds on itself like a financial cancer, and just like cancer, the cure costs more than most people can afford. But unlike cancer, this disease is designed by a committee and approved by shareholders. They tell you to build an emergency fund. But medical emergencies don't respect your savings account. You saved $5,000 over 3 years. Your emergency room visit cost $8,000 in 4 hours. You did everything right, and you're still wrong. You're supposed to have 6 months of expenses saved. But one ambulance ride costs more than 6 months of groceries. The financial advice that works for car repairs doesn't work for heart repairs. Your emergency fund isn't an emergency fund. It's a medical co-payment for rich people. You can't budget your way out of a system designed to bankrupt you. Every dollar you save is just a slower way to go broke. They want you to be responsible with money that doesn't exist for problems you can't predict. You're playing financial chess while they're playing financial warfare. And the house always wins because the house owns the hospital. The cruelest part is how they make you grateful for the privilege of being robbed. Thank you for choosing our hospital. Thank you for choosing our insurance. Thank you for choosing to not die today. You say thank you to the people charging you $10 for a Tylenol. You apologize to the billing department for not being able to pay for your own survival. You feel guilty for getting sick like it was a choice. You feel ashamed for not having enough money to afford being human. They've trained you to be polite while they're picking your pockets, to smile while they're stealing your future, to be grateful for a system that views your life as a profit margin. You thank the doctor who saves your life and bankrupts your family in the same conversation. That's not gratitude. That's Stockholm Syndrome with a stethoscope. And they're counting on you to keep saying thank you while they're counting your money. Here's what changes everything. Medical debt is negotiable. Not the medicine, not the treatment, but the bill that comes after. Hospitals would rather get something than nothing. That $12,000 emergency room bill? Start with $1,200. That's $60,000 surgery. Offer $6,000. They'll act offended. They'll say it's impossible. But impossible is their opening position, not their final answer. Call the billing department like you're buying a used car, not begging for mercy. Because that's exactly what you're doing. You're buying your own medical care at marked up prices from people who marked them up. Ask for itemized bills. Half of what they charge you for didn't happen. Question everything that sounds like it came from a foreign language. Most medical bills have errors that cost you thousands. You're not being difficult. You're being smart. They don't want you to know this. But now you do. If this made you realize you've been paying for a lie, hit subscribe. The medical system banks on your ignorance and your fear. Don't let them profit from both. There are more financial traps hiding in plain sight, and you deserve to see them coming. Subscribe if you're ready to stop being grateful for getting robbed.